In this topic, we're going to learn the acceptability criteria of the pulmonary function test. So, at the end, expiratory volume of the three tidal breaths. So, the end expiratory volume of the three tidal breaths that precedes the vital capacity maneuver varies by less than 1 liter or 0.1 liter. So, not exceeding siya sa 1,000 ml. So there will be no coughing during the maneuver that interferes with the pulmonary function test. The accuracy of the test result defies the accuracy of the maneuver. So no variable effort is demonstrated by the subject or the patient during the maneuver. So there will be no volume loss from the leak of the system in the mouthpiece of the spirometer, no obstruction of the spirometer mouthpiece. The patient maximal expiratory and inspiratory efforts are determined or demonstrate with the observation volume of the plateau. So this is a recommendation of the ATS or the American Thoracic Society as well as the ERS or the European Respiratory Society. So there will be an international guidelines or criteria for the acceptability of the test. In the Philippines, so we're going to have the Bruns criteria instead using the American standard, no? So we are only uh, accepting the ATS by the practice such as like in St. Luke's, the Medical City. So we're using the ATS guidelines or the American Thoracic Society. So for the acceptability criteria, it should be not less than zero point 0.1 liters ang difference between the test. Anong ibig sabihin nito? So the next video, we're going to see the definition, no? So, anong kailangan natin? So, the acceptability criteria. So, I will show you the video for this acceptability criteria. So, this is the video for the not less than 0.1 liters per test. So, there should be no leak, no? So, dapat naka-seal yung mouth. So, if you're using prosthesis, so we suggest sometimes to remove the prosthesis of the patient or postizo to avoid air leak sa mouthpiece ng spirometer. So, the mouth should be placed on the mouthpiece according to the manufacturers or requirements. So, walang leak siya dapat. So, dapat naka-seal. So, sometimes we use nose clip to air seal, no? So all the air going to the mouthpiece must come from the lungs direct without no leak. So the nose is such as sometimes the cause ng leak yung nose breathing. So dapat naka-nose clip sa patient. We put nose clip for spirometry rest during the breathing maneuver. So that represent the force vital capacity ng patient. So the force vital capacity in 1 second. So there should be no coughing for the artifacts kasi if you're going to review later the graph of the volume loop, certain artifacts such as coughing will be identified as an artifacts in your graph. Next, the reproducibility criteria, or in other term, reproducibility, other correlate with the repeatability of test. So in this criteria, it also represent the precision or the accuracy from one test to another, or from one maneuver to the other maneuver. We're speaking about the breathing maneuver na specific. So pagbuga ng patient at the end of his expiratory, that is one maneuver, no? So one vital capacity, of course, vital capacity execution or maneuver represent one breathing maneuver. So dapat tatlo. Per the difference in terms of liters. So the repeatability criteria as published by the guidelines, so represent the reproducibility or slash repeatability criteria. So the largest force of vital capacity, or IVC, no, the largest vital capacity and second largest vital capacity values are within 0.2 liters. So ibig sabihin to each other. So, nasa 200 milliliters sila. So, the graph of reproducibility criteria between the first VC largest and the second largest VC must be 200 liters. So, hindi siya dapat lumampas ng 200 liters. So, in this criterion is not met after 2 tests. So, testing must continue until 0.200 ml is achieved to each other. So the criterion is met with additional acceptability of tests. So total of 4 tests have been performed. Patient cannot continue. So this is a strict standard. So dapat tatlo lang. So the maximum breath maneuver in Philippines must not exceed 8 maneuvers. So pag 8 maneuvers, we terminate the procedure and reschedule the patient for the next PFT because hindi na siya accurate. So the lungs na you create a strenuous lungs if you exceed by practice 4 maneuvers. So in this criterion, you should have the total of at least 4 or 3 as established by the PCCP, 3 maneuvers, and that is acceptable. So in direct spirometry, so this is the higher form of nitrogen. We have the nitrogen washout, so open circuit method. So this is performed in such hospitals such as St. Luke's. In Iloilo, we have St. Paul's. So we are using the body box or body plate sonography. This equipment costs about 8 million pesos. No, so you'll be using the SV 3000 for the body plate sonograph for the nitrogen washout. So this method is called the open circuit method. So we have the patient breathes 100% oxygen while the nitrogen washout of the lungs is measured. Assuming that 79% of lung volume is nitrogen, so several problems with this test. So problem with nitrogen washout tests such as atelectasis or collapse of the lungs may result from the washout of nitrogen from the poorly ventilated lung zones or obstructed areas, elimination of hypoxic drive of carbon dioxide, retainers is possible for COPD cases, underestimate the functional residual capacity of the FRC due to underventilation of areas with trapped gases in the lungs. So criteria of ending the nitrogen washout test. So a nitrogen washout test is successfully completed when the following criteria is met. So the exhaled nitrogen levels decrease to become less than 1%. For subject without obstructive disorders. So the test may have to be prematurely discontinued if the following occurs. So if there will be a system leak, the patient is not able to continue the test, so the TSOT spirometer use become full. So helium dilution. So it's a closed circuit method known a volume and concentration of helium added or the helium gas is added to the lungs and it will be diluted in proportion to the size of the lung volume. So the criteria for ending an helium dilution test.
The single-breath nitrogen washout test is based on this hypothesis. The seated patient takes 2 breaths of air and exhales to residual volume. Then the valve on the mouthpiece is turned to administer 100% oxygen. The patient takes a deep breath of the oxygen to total lung capacity, and then exhales slowly to residual volume. The concentration of nitrogen in the expired gas is measured continuously using a nitrogen meter. Additionally, exhaled volume is measured using a pneumatograph. A plot of exhaled nitrogen concentration versus exhaled volume is generated. A typical plot appears as follows. 4 relatively discrete phases of the curve, 1, 2, 3, and 4, are depicted. Phase 1 represents the initial portion of the expert, which is devoid of nitrogen since pure oxygen was inhaled during the previous breath. This portion represents gas residing in the proximal airways from the end of the prior inspiration. Phase 2 constitutes a mixture of gas from the central airways and the alveoli. Phase 3 is defined by a mixture of gases from the lung apices, mid-lung zones, and lung bases. And Phase 4 constitutes gas arising predominantly from the apices as the airways at the bases
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access.
So next we're going to learn about performing the helium dilution. In this video, you're going to observe the demonstration of the helium dilution test for spirometry.
Performing helium FRC. We recommend that the technician plans a small chemical absorber before starting the test to check the status of the dryer. If it has turned pink, it will be necessary to change the chemical. Before a helium dilution test can be run, the system will automatically prepare the closed circuit. A pop-up window shows the status of the automatic flushing and filling routine on the spirometer. Having flushed the spirometer and filled to the midpoint with room air, helium, and oxygen, the software checks for any leaks and waits for a stable starting helium value. Typically, the initial helium reading will fall between 12 and 14%. You will notice that the starting oxygen in the circuit will be close to 30%. The reason for this is that it provides a comfortable oxygen setting for patients with CO. The subject should be seated comfortably upright and be wearing a nose cone. Since the measurement being made is FRC, it is important to let the patient relax and be at a steady state before turning into the spirometer. Press the space bar when you are satisfied with the subject's tidal breathing is stable. Next, end tidal gravity and switch the patient into the closed circuit. From this point onward, the display of volume is coming directly from the spiral. Helium dilution studies usually take between 3 and 5 minutes before, so encourage the subject to relax and just breathe. In Compass, there is a line drawn at 2 minutes, which indicates the minimum time allowed to run an FRC study. After a minute or so, observe the tidal breathing pattern on the circuit. The spiral arrow automatically replaces the oxygen used by the patient to maintain a stable tidal volume condition. The runtime screen is always looking at the end tidal volume reading in relation to FRC baseline, the starting position of the spirometer. As the test progresses, the runtime screen will display the tidal volume, helium equilibration, and also give the user an estimate of FRC as it begins to stabilize. The bottom right-hand side of the screen indicates the oxygen compensation. When the low indicator is green, it means that the standard flow of oxygen is entering the closed circuit at 250 milligrams per minute. When the supplement indicator goes green, it alerts that additional oxygen is being supplied to maintain the volume baseline and the starting oxygen. Once the software sees a stable condition, the screen will ask you to repeat the operation. The helium dilution curve should now be a flat line, and the estimated FRC should also be stable. When you are satisfied that complete calibration has been reached, press the space bar. Now, ask the patient to perform an SVC. Take a deep breath in as far as you can. Make sure that they are fully inflated. Then encourage them to breathe steadily out. Slowly empty all the air out of your lungs and squeeze every drop out until you are completely full. Pressing spacebar will end the test and all results will be displayed. If you want to repeat the test, the subject should be given at least 5 minutes to return to normal lung conditions. On the mini results screen, right-click functions allow the manual selection of data if the technician wishes to change the results.
So this is all